Okay. Um, we can start to show the scenario now. So this is a scenario uh, of communication skill case station 4. The scenario is Mr. Sami is 60 years old. He was admitted 2 days ago because of pneumonia. His condition was improving. Yesterday, last night, he developed back pain. Codeine was given to him in the best interest of his condition. Unfortunately, he developed allergy to codeine with a skin rash and hypotension. He was given anti-allergic medication and his condition was stabilized and he was put under close observation. His known case of allergy to codeine before, which is written and recorded um, in the records. You are SHO of the medical department in call today. You have been asked to discuss this issue with Mr. Amr, his son. He was very angry for what happened to his dad. So this is counseling for you have to decide and you have to organize your thoughts. What's the counseling for here? Is counseling for chronic illness? Is counseling for breaking bad news? Is it counseling for a procedure? Counseling for a side effect of medication or counseling for a medical error, a medical negligence? It's very obvious that it is counseling for a medical negligence. This is one of the tricky cases actually which is coming in the exam, and the approach of this case is quite different from approaching a case of chronic illness, counseling for chronic illness or breaking bad news. As we discussed before, that the scenario or approach of a case of communication is a short tragic film, and you have to make your mindset and a brain map about the case and to write down the headlines of the case before going inside. So the headlines of approach of a case of counseling for chronic illness is introduction, breaking the news gradually without jargons, showing empathy and sympathy, social history, check understanding, a summary about the case, concern, and help. In this case, the headlines will be quite different. So let's approach the case and then we can discuss how to approach the case in a proper way later on. Um, anyone want to present the case with me? So Aisha, would you like to
Yeah, yeah.
um, present this case?
Okay, that's fine. I can do
All
it.
right. So okay, you have 1 minute or a couple of minutes to write down the headlines and on your the brain map of this case, and then we can discuss. Of course, here you are going to talk to the son who's angry uh, for what happened to his dad. Write your headlines, and then we can start. What is it? So I'm sorry, I didn't have time to make this scenario in PowerPoint, so I used PDF instead, which
Okay.
would be appropriate
Yeah, no, that's fine.
mostly. Um, Derisha, you can open the camera if you wish,
Yeah, that's fine. I'll do
just to
that.
make it virtual interaction between the surrogate and the examiner,
Mhm.
or the patient, the surrogate and the candidate. Would you like to start?
Yeah, that's fine.
Yeah, time.
Okay. So hello. My name's Dr. Aisha Goma. Can I confirm your name, please?
Yes, doctor. I'm Mr. Amr, son of Mr. Sami, 60 years old.
Okay. And can you confirm Mr. Sami's date of birth, please?
Yes, doctor. He was born on 20th of July, um, 62,
Okay.
1962.
So thank you. So I just want to ask you first, what do you know about what we're going to discuss today, or what about this meeting?
Yes, doctor. I know that my father was admitted a couple of days ago because of pneumonia,
Hmm.
and he started to develop back pain for which he was giving codeine, which is he's well known um, to be allergic for, and it is well written clearly in the recorded that he has allergy for codeine, doctor. And I know that he was given codeine, after which he started to develop severe allergy for it. So I'd like to know how this happened, doctor.
Okay. So just to start off with, I do want to apologize about the mistake that happened. Um, I'm not sure how this happened and if it's clearly written on his notes he was given codeine, but there may have been some miscommunication that happened somewhere along the line from him being prescribed the codeine and being given. I would like to let you know that this is something that we will make sure that this does not happen again.
Um, okay, doctor. I'd like to know what happened and why this happened. If it is clearly written in the notes that and he's recorded that he's allergic for codeine.
Hmm.
I consider this is something serious, and this serious incident, doctor, and maybe negligence.
Yeah.
And I'd like to know what you're gonna do toward that.
Okay, so it is absolutely a serious incident, and it is one of the things that we would. Um, it should be something that shouldn't happen for patients when they're in hospital. So I do appreciate your frustration and your concerns here. Um, Obviously, I wasn't there at the time, so I'm not able to give you the exact details of how it happened. But but I do want to reassure you that Mr. Sami has actually improved. The allergy was picked up quickly, and he was treated appropriately accordingly, and his condition is now improving again. So I would like to, reassure you from that point of view. Now, going forward, these are one of those things that we will need to investigate. So we will be doing what we call a DATEX, which is a reporting of the incident, so that it can get investigated. And we will, once we find out what exactly happened, we'll be speaking to the relevant people involved with this incident, and also making sure that other people learn from it, to avoid this happening again in the future.
Okay, doctor, I'd like to know what action you are going to do to avoid such incident to happen in the future for any other patient.
So we will be discussing these again, as I mentioned, we'll be doing this incident reporting, and then we will be discussing and sending reminders to all staff who are involved in prescribing medication and also staff who are involved in giving the medication, reminding them about the importance of checking patients' allergies before giving the medication, um, checking against the record, but also checking with the patient themselves at the time. Um, I think this happened when the codeine was given to your father. This was being given in his best interest because of the back pain he had, but unfortunately in his case he was allergic, and for somehow this was missed, but we will make sure that this doesn't happen again.
Okay, doctor, I think I'm going to to make a complaint, doctor, for what happened to my dad.
Okay, so I would actually want to support you in making this into making a complaint, because we wouldn't want to try and stop you from doing something like that, because your dad was put through harm as a result. I can provide you with the details of the PALS team, who you'd be able to discuss this with in more detail, and who will also be able to look into this to make sure that this is something that doesn't happen again.
Okay, doctor, I'd like to know the name of the doctor who prescribed this medication to my dad, doctor.
So I'm not sure who the doctor that prescribed the medication is, but I can reassure you that when we investigate this internally, we will do our best to find out who it is, and we will speak to that doctor involved in person to make sure that they learn from this incident, and that they are sort of dealt with internally. But this is something that I wouldn't be able to share with you. I can reassure you it's not something that we're just going to ignore and brush under the carpet.
So you are trying to defend your colleague, isn't it?
So I completely agree. My colleague has done a mistake, and we will be investigating this. But this is not something that I would be able to share with you. And as I said as well, I'm not personally. I'm not sure who the person who prescribed the medication was, but we will look into it and find out and make sure that they are they know, they are aware of what's happened, and that they learn from this so it doesn't happen again.
Okay, doctor.
Okay, so is there any other questions or anything else you want to clarify with me?
No, doctor, it's all right. I'd like just to know if he was given another painkiller which is saving his condition.
So I will have to check his drug chart, but I think we would have, I'm sure my colleagues who are looking after him would have made sure that he had some other alternative painkiller prescribed. We would want to ensure that patients are not in any pain or suffering when they're in hospital, and we'll do as much as we can to make sure that any pain they have is well controlled. So I'll double check his prescription, and if he's still in pain, I'll make sure that I prescribe him more pain relief to make sure that he's comfortable.
It's all right, doctor.
Okay, so just to summarize, we will be investigating this, within the department, and we'll also be discussing with both the doctors and nurses about the importance of checking patient allergies, both against the record and with the patients directly, to avoid something like this from happening again in the future. And I want to reassure you that we're taking this matter seriously.
Okay, doctor. Thank you for that.
Okay, Norris, thank you for your help. Okay, thank you for your time.
Thank you, doctor. So you're finished?
Um,
Because
I think
still, till
this,
we just had 8 minutes. Still, you have 6 minutes.
yeah. Um,
It's quite early.
mm,
Okay, thank you, doctor. So discussion with the examiner.
okay.
Do you think that you reassured and calmed down the son of the patient enough?
I think I addressed all his concerns, and reassured him that we will be investigating this. He did. Um, he seemed happy with the outcome of the discussion, I think.
Right. And what do you think about this incident? Do you think it's just medical error or medical negligence?
So I would say it's a medical error. So the codeine was prescribed in the patient's best interest to treat the pain that he had. But for whatever reason, the prescriber overlooked the allergy, and was incorrectly prescribed. And then this again was missed by the nursing administering the pain relief. So this is something what we would want to sort of, call as a never event or a serious incident that should never happen. But things like that rarely do happen, and it needs to be taken seriously to ensure that staff learn from it to avoid it happening again in the future.
Right. And what official actions you're gonna do regarding this incident to avoid such to happen again in the future?
Okay, so we would want to, so for duty of candor, initially to make sure that the patient and that his relative, as we've done now, are aware of the incident. Um, as the patient's son wanted to put in a complaint, I would give him the details for PALS so that he's able to take this further if he felt the need that this is something that he would want to do. But from our side, we'd want to put in a DATEX, reporting the incident, to have that investigated, and for a senior member of staff to have a discussion with the doctor involved in the incident, and the nursing staff involved as well, to find out why and how this mistake happened, and to discuss if there's any further learning or training that they require, and also on a wider basis, just reminding all staff in the department about the importance of checking allergies.
What are the ethical issues here in this case?
So there's more than one ethical issue here. So the main one is informing the patient and their relative of the serious mistake that's happened. So duty of candor, and making sure that they are informed and that we're not withholding essential information from them. And also the ethical issue of the mistake itself of the patient's records not being correctly checked. The main one
Okay.
would be, I think, a duty of candor that was because of the resultant in patient harm that happened.
Okay. Thank you. Thank you, Aisha. We can open discussion now. Do open discussion about the case. If anyone has any comment or anything which could be missed from Aisha.
Just
Uh,
one thing I want to ask that when you said it's a 6 minute time still remaining, because it's quite a long, awkward pause.
Mm.
Was she going too fast, or how does usually the scenario runs in actual setting? Just want to ask about that.
she didn't go so fast, but she missed some topics here to be covered. For example, she didn't ask about social history, and we had agreement before social history is very important. In any case of communication, history taking, or station 5. And even, especially in this case, where there is a medical error or a medical negligence and the son is very, very angry at that time, social history can calm down the situation. And if you are asking about social history of the patient and looking at, if you explained and if you showed that you are careful about the social history and social support and financial support, I think this will contribute to calm down the situation. And um,
So can I just ask what kind of social history would I be asking? Because I feel
yeah,
like
social history, like with who the patient is living at home, is he will support it at home, if he need any social support when he's medically fit for the charge, who's looking after him at home. Um, you know, it seemed that it is not appropriate, but in this case, actually, to make or to show to the patient or the son that you are careful about the patient and you are careful about his social support at home and you are eager to help him if he's medically fit or when he's medically fit, and to offer social support if he's living his own at home, for example. um, this is one of the important issues should be um, raised up in any communication case. Okay. Um, okay, what else? Anyone has any comment or want to raise up any point? Okay, if we went to the case, this is the skeleton of the case. Number one is
Can
introduction.
you hear me?
Yes, Noor,
Oh, sorry. I think my speakers weren't working. I was trying to say something twice.
that's all right.
Um, I think the station, like Aisha addressed the concerns well. I think she just needed some prompting, like with the datex, and I mean, she answered it well. But I think ideally she should offer this information before he's asking. And I think mentioning like the clinical governance meeting or the morbidity and mortality meetings where these things are discussed and then the outcome can be shared with the patients. So just explaining the whole process in detail, a little bit more in detail, and then saying maybe like the outcome of that of the DATEX or the clinical governance meeting will be shared with the family or the
Yeah.
patient so that they know what is being done. I think that is probably something that they would want to know. Um,
Yeah.
and then, like in the end, she asked about if he had any other concerns. I think she could have also summarized to say, like, at this point, we're going to do this, 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 including like giving him the information for the the leaflet that she said she was going to give for the pals. So I think overall,
Yeah.
she mentioned most things. It's just because, like you said, there was a lot of time, so that she had time to expand on the things that we were going to do
Yeah.
because the patient's family probably don't understand any of these procedures. But I think in terms of like what she said, she addressed all of his concerns, and he seemed, he asked her a difficult question of like asking the doctor's name. So I think she handled that well. I just think,
Mhm.
and I think like in the discussion, I would say the ethical issues, we always have like the four major ethical, which is autonomy, beneficence, maleficence, and justice. So I think in this
That's it.
case,
Yeah.
probably maleficence because there was harm to the patient, so that was an issue, and then beneficence because we should be giving benefit. So she could have mentioned those as well. I think these are key ethical principles that we should mention, at least one or two of them when asked in this scenario. This is the feedback that I have.
Yeah, yeah. As we discussed before, we have 4 or 5 ethical issues actually, which are fixed for all the cases. Autonomy means that the patient or the family, they have the right to know everything about their condition and the share the management plan. Beneficence, not to do good for the patient. Non-maleficence, not to harm the patient or do any harm to the patient. Honesty, to be honest with the patient or the family. And justice, all patients should be treated, equally regardless of their race, religion, or um, thoughts, or yeah. So these are fixed ethical issues for all the patients. Um, yeah, I think Aisha did well, but she should do more actions that we are going to discuss later. More actions for what should be happened and what should be action should be taken to avoid such incident to happen in the future. Summary, she didn't summarize. That's why she had plenty of time and she didn't finish in a proper time. She had um, a lot of time to finish. So let's start from the beginning. So the skeleton or the headlines for this scenario will be number one is introduction, and she did introduction very well. Number two is apologizing a lot and admitting the error. This is very important in such cases. Apologizing a lot and admitting error. Number three is explain the incident. Actually, Aisha didn't explain the incident from the beginning. What happened? He was admitted for what, and then he was giving what, and for the after which he started to develop allergy. For which we started proper medication, the form of anti-allergic medication, and he was put under close monitoring, and his condition is stable now. This will take some time, explain the incident, what happened exactly. Apologize again, and then this is a core of this case. Explain what action you are going to do to avoid such incident to happen in the future. Then social history, concerns, and summary if you have time. Summary and concern. Okay. So let's start from the beginning. Introduction. Check handles to introduce yourself. Confirm the patient identity. May I confirm that you are Mr. Amr, son of Mr. Sami, or even you can ask the patient or the surrogate himself. May I confirm your identity, please? Are you the next of kin of Mr. Sami? This is very important. If the next of kin or not, because you should meet or you should do the discussion with the next of kin. Confirm agenda because he may be his cousin, or maybe his niece, which is the next of kin. So it's more appropriate to discuss with the next of kin. Confirm agenda of meeting. We are meeting today to discuss what happened to your father. Is it okay for is it okay with you? Ask the son how much information he know about his father's condition, or how far he know about his father's condition, and let him to express his feeling and anger, because in such condition the surrogate will be very angry and anxious. Let him to finish and express his anger and anxiety. Then apologize a lot and admit the error. This is the second chapter of our tragic story, or a short film. I really appreciate your feeling, and I'm really sorry for what happened to your father. Um, be sure that you know that any harm was not intended or meant at all. I admit that what happened is something wrong and not accepted. So you have to admit that and don't argue that this is what happened is something serious and shouldn't happen, and not accepted. May I explain to you more about what happened exactly? Explanation of the whole story and the incident. That your dad was admitted a couple of days ago because of pneumonia, and last night he started to have or to complain of back pain, for which he was prescribed codeine in the best interest of his condition. And unfortunately, he developed allergy for codeine with some skin rash and low blood pressure. Codeine was stopped at once, and he was given anti-allergic treatment at once, and his condition was stabilized, and now he's under close monitoring. He is known case or his known case of allergy to codeine before, and that's happened mostly because of breaking of communication or missed information. This is the explanation of what's happened, and you have to admit this happened because of lack of uh, communication, or breaking of communication or missed information. Explanation of the incident and why it happened. Then apologize again. I'm really sorry again for what happened to your dad. I know how much your dad should could be precious for you, and be sure that he's precious for us as well. Um, and be sure that we are going to investigate that seriously. This is the core of this station actually. What action you are going to do? So number one, what we are going to do to avoid such incident to happen in the future: to write incident report for what happened, to inform the consultant and nurse in charge about what happened, to write in clear, obvious notes in your father's file that he's allergic to codeine, not to be given to him again in the future, to discuss this issue in the next morbidity and mortality meeting to avoid such uh, incident to happen in the future, to refer this issue to the risk management team to be investigated seriously if it's okay with you, and then to update you about the result of the investigation. So we here we ask it for maybe, or we did maybe 4 or 5 actions to be done in such serious incident. Instant report, inform consultant and nurse in charge, write in obvious note that he's allergic for this medication not to be given to him in the future, discuss this issue in the next morbidity and mortality meeting, refer this issue to the risk management team to be investigated seriously, and to update you about the result or the outcome of the investigation. If the son is still angry, apologize again and clarify for him that you are here to help his father and help him, and any harm was not meant at all. Social history. Again, Aisha asked you what kind of social history here. Any patient actually, you have to ask about his social history, if what he's doing for living, if his illness impact his job or usual daily activities, and you can with who the patient is living as at home, and if he will support it at home. If not, offer him social support. We have a social team here who can come and offer and provide him with proper social support at home. Okay. No need actually to ask for smoking and alcohol here. No need for that. If he's financially supported. And summary at the end about um, your apology and your actions you are going to do again, and the concern. May I ask for the name of the doctor who prescribed this medication to my dad, doctor? Actually, Aisha replied this question in a professional and proper way, because it is not allowed actually for you to give names in a case of a complaint. I'm not defending my colleague, but we are working here as a one team, and all the team members are responsible for your father's condition. This is a proper way to reply this concern. I want to make a complaint, doctor. Uh, of course, this is completely the right of the patient or anyone of the family member to make a complaint. Yeah, this is completely right, and I can help you by referring you to the patient advice liaison office, and we can follow up the complaint with you and the result of the complaint as well. Sometime, some relative or patient can feel um, can be afraid that if they raise up a complaint, their patient may be discriminated. So you have to reassure them that be sure that the plan of management of your dad will not be affected at all um, by the complaint. You know, just to calm them down. Make summary and help at the end. We can give you the contact number of our department, and you can contact us anytime if you still has any concerns or queries anytime. Okay. So this is how to approach a case of medical negligence. Is it a medical negligence or a medical error? Actually, here we have clear news, and it is well recorded in the system that he is allergic to um, codeine. Despite that, he was giving codeine because of misinformation or lack of communication or breaking of communication, which is our fault at the end. So it is considered to be medical negligence actually. Medical error mean that if this patient develop allergy and it is not well known before and it is not recorded in the system that he's allergic for this medication, this is a medical error at that time. But if it is well recorded in the system, it is medical negligence because of breaking of communication and lack of information. Let's differentiate between medical negligence and medical error. A medical negligence means that occurs when a doctor, nurse, or other healthcare professional fails to provide a patient with an acceptable standard of care. This encompasses many different situations. For example, surgeon and oncologist may be negligent in mistakenly cleaning a patient for a surgery by performing procedure that the patient, clearing the patient for surgery by performing procedure that the patient didn't consent to, or by making mistakes during the procedure that could have been prevented. Radiologists and oncologists may be negligent when they fail to timely diagnose a cancer. Hospital nurses and nurse home staff may be negligent when they fail to communicate important information about the patient to the attending physician, when they fail to record important data in the patient medical records or charts, or when they fail to properly position a bedridden patient in order to avoid bed sores and ulcers. Primary care physician may be negligent when they prescribe the wrong medication for a patient or by failing to consult with a medical specialist regarding the patient condition. All of these are um, considered to be examples of medical negligence in addition to our case, prescribing a medication and that the patient is well known to be allergic for, and it is well written and recorded in his records. Okay, what are the medical errors? Medical errors mean that unavoidable complication when adverse consequences that occur during the course of medical treatment but are not the result of negligence on the part of the doctor, nurse, or healthcare professional. In many cases, these errors were unforeseen, unavoidable, and due to an inherent risk that couldn't be prevented. For example, of medical error, okay, in which the patient who has developed an infection is prescribed a common antibiotic in which he or she is allergic. Because of this, the patient might, for example, suffer other medical complication. But unless there was something in the patient chart or medical history to suggest to treat the physician to the treating physician that the patient is allergic for this medication, the act wouldn't be considered negligent, like in our case. So in this case, in the scenario, if it is mentioned that, the patient is well known or his records showed that he's allergic for this medication, this is medical negligence. If it is not shown in the on the scenario that the patient is allergic for this medication or in his records, this is medical error, because we give him this medication and he is not well known before to be allergic for this medication. Actually, the approach of medical error is quite different from medical negligence, and we can have a case later on about that. Despite the adverse consequences, the physician acted like any other reasonable physician would have acted under the same circumstances. On the other hand, if the physician knew that there was a risk of the patient having the allergic reaction to the antibiotic and prescribe it anyway without considering more suitable alternative, a case could be made for medical negligence. But of course, if the patient was given antibiotic, which is a common antibiotic, and was prescribed in the best interest of the patient condition according to the local policy or guidelines, and the patient start to develop allergy for it, this is medical error. Approaching of a case of medical negligence is different from approaching a case of medical error. In a case of medical negligence, like in our case, you have to apologize, show empathy and sympathy, admit the medical negligence, and take actions for an investigation that mentioned in the scenario. In a case of medical error, your task is to show your empathy and sympathy, explain the whole condition, and even to the patient or the relative, explaining that medical error can happen in the medical field and no medical negligence exists, and you don't have to make the actions of investigation that we discussed in this case. That's why you have to decide if that medical error or medical negligence. For example, there is another scenario in the exam which is coming, a case, a patient developed a C. diff infection, pseudomembranous colitis after antibiotic. So this is approach of a case of medical error, because you don't know that a lot of antibiotic can be complicated by pseudomembranous colitis. It is one of the cases, one of the common complications or side effects which can be or can present or can complicate antibiotic at all. So the at that time um, the approach will be different, and we can see actually this case just to compare between both of them. Oh, it's not here. Sorry. Maybe later on. So yeah, this is the how to approach a case of medical negligence. Do you have any question or any concern at all about this case?
No, I think that's fine. Thank you.
I think it was really good to talk about errors and negligence. Like, I feel like I learned something from that.
Yeah,
Thank
so we
you.
have to bear in our mind that approach of medical negligence is quite different from approach of medical error. In medical error, you have to apologize for what happened to his father and show your empathy and sympathy. Number two, you have to explain what happened. And number three, you have to explain that side effects and the complication of any treatment cannot be avoided sometime, and it can happen in some patients. Um, but of course, it is not not meant at all. But you don't have to make actions like that. No need to discuss, to make incident report. No need to refer this issue to morbidity and mortality meeting or to refer to risk management team. These actions are taken only in a case of medical negligence. Other scenarios of medical negligence which are coming in the exam, if the patient develops sores during admission, for example, so there is lack of repositioning of the patient. This is a medical error. Um, Another medical error could be, what else? Other scenarios are coming as medical error in medical negligence in the exam. These are the most common actually. The medical error in the exam is patients start to develop one of the side effects of medication, like C. diff infection after antibiotic. It's very common, which is coming very frequently in the exam.
Sorry, can I just ask, why is C. diff a medical negligence if it's
No, it's error.
error? Why is it an error if it's a side effect from the medication?
The error mean that something wrong happened secondary to treatment plan. This something, is it a complication? If it is a complication or a normal complication or one of the side effects or consequences, this is error. And negligence mean that there is negligence um, and obvious negligence in a case of recorded allergy, for example, or a case of um, keeping the patient for a long time on his on the bed without repositioning, after which he developed this sores with sores. So error doesn't mean that uh, error is different from negligence. Error is unavoidable and one of the acceptable complication of the medication. For example, methotrexate, patient on methotrexate for a long time and start to develop lung fibrosis. This is not a medical negligence. This is a medical error. A patient develop, for example, thyroiditis after amiodarone. This is a medical error, not medical negligence. Medical error means side effect of medication, you know. Okay, and we explained we explained and differentiate between both of them, you know. Here this is a medical error and here is the medical negligence, and we give examples for both of them. I can send you this case in your email. Okay, you can have it just to be a baseline and a case example for any case coming to you as a case of medical negligence, and also to study what the difference between medical error and medical negligence. Okay, someone was going to talk. Yes, Noor.
I just want to ask that if there is a scenario like there is an outbreak of norovirus in one of the ward, will that be again a medical error?
Sorry, say it again.
Like outbreak of norovirus in one of the wards and the patient is suffering from diarrhea and vomiting, will that be a
No, no, this medical error, yeah, but not medical negligence.
yeah. Okay.
Yeah. All right, so we finished our case today. Next session will be on, we agreed on Friday, right?
Yes, great. Thank you very much.
Friday at 2 p.m.
Friday.
Thank you all. Again, don't forget about the feedback, please, just for the appraisal and revalidation. Next Friday, we are going to discuss a case of Station 5. Yeah, thank you all.
So just for
Uh,
station on Friday, shall we meet in the office area outside of AM, like near AMU, because there's no rooms in the education center available?
This will be better really to know how to do the examination of Station 5. It's right. It will be a case of acromegaly. Okay.
Okay.
Approach of a case of acromegaly. Okay, thank you all. Have a nice day. Take care.
You
Thanks a
too.
lot.
Thank you.
Thank
Okay,
you so
bye
Thank
much.
bye.
you. Bye. Bye.